As you think about becoming a surrogate, it's important that you learn about the possible physical and emotional effects of becoming a surrogate. American Surrogacy has services in place to help minimize the possible risks of being a surrogate in order to protect you throughout this process. With pregnancy, there's always a level of risk. That's why we're looking for women who have a history of healthy, complication-free pregnancies. When you're becoming a gestational carrier, it's a different way of becoming pregnant. You will need to prepare for injections for at least 3 months. Some have complained that the injection site can be a little painful, there can be some allergic reactions, and everybody is different. However, there are not many medical risks associated with the embryo transfer, other than your typical mild cramping or slight bleeding. Some have said that the full bladder that you have to have during the embryo transfer can be a little uncomfortable. During your first trimester, your OBGYN will stop your fertility treatments, so your second and third trimester of the pregnancy will be exactly what you're used to with your pregnancies. Generally, there can be some risks associated with a multiple pregnancy. It is going to be up to you as to how many embryos you want to transfer, and we will work to match you up with the family that feels the same. Just keep in mind, this is a different way of becoming pregnant than anything that you're used to, so there are going to be some side effects to the fertility treatments that you did not experience with your pregnancies. Pregnancy is always an emotional time. With pregnancy, you're always going to have a fluctuation in hormones and levels, so there can be a risk of postpartum depression. Surrogates usually feel excited, proud, and a little relieved that this journey is almost over. However, it can be pretty normal to feel a little sad because of the investment with the intended parents. But most of the surrogates that I work with are so excited and happy for their family as they got to watch them into the delivery room and become a mom and dad, sometimes for the first time. American Surrogacy works to minimize the risks of being a surrogate mother. We do this in our surrogate screening process by making sure you're mentally, physically, and emotionally ready for this process. We also do background checks on intended parents to make sure you feel comfortable moving forward with this family. We have access to professional counseling and support services where your surrogate specialists are available to you 24 hours a day by text, email, or phone. We work with a third-party escrow service that is completely separate from our agency, so there is an outside party making sure that you are paid correctly and safely. We also have access to legal representation, which is there for you to make sure that you feel comfortable during the contract phase. Every surrogacy experience is different, and there are a number of factors that could affect your physical and mental well-being. It's important to discuss all of the possible risks of surrogacy with your surrogate specialist and your OBGYN first. Please contact American Surrogacy if you have any questions on the risks of being a surrogate.